Hi, my name is Natasha, and I want to start by asking you a question. What medical problem do you think was found in 2018 to cost the NHS £6.5 billion every year? 6% of revenue expenditure. This medical problem leaves many patients disabled, resulting in almost a third of this amount being spent on community nursing. Finally, this 6.5 billion has been growing on average at 10% a year. The answer is chronic wounds. If a wound is not healed within 6 weeks, it's defined as chronic. Chronic wounds are very common, affecting roughly 2% of the UK population. There is an enormous human cost associated with chronic wounds. They can lead to decreased quality of life, extended periods of disability, and amputations. I've been working on this project with father and son, José and José. Dr. José is a doctor in the Portuguese NHS with over 44 years of clinical experience. He has spent the last 14 years treating chronic wounds, specifically leg and diabetic foot ulcers. His son, José, is a software engineer working in startup. Together, father and son want to share their experience that Dr. José has built up over the years with other doctors and nurses through technology. Wound infection is a main factor that prevents wound healing. I will start by telling the story of an unlucky patient with an infected wound. It begins with the patient going to the hospital and receiving an initial clinical examination. Inexperienced medical professionals may miss signs of infection and send the patient home without the correct treatment. When the wound gets worse, the patient returns to the hospital and is referred to a specialist like Dr. José. On examination, Dr. José detects signs of infection and prescribes the correct treatment. However, by this point, the wound has worsened, and so it will take longer to heal. So, what's the solution? We were looking at creating a machine learning tool that will help doctors and nurses to detect wound infection using images taken on mobile devices. By increasing the detection rate of wound infection, we can reduce the time between initial assessment and the patient being referred to a specialist to receive the correct treatment. Dr. José has collected around 6,000 images of wounds, and he has labeled these with infected or uninfected based on whether there are signs of infection present within the image. To build the image classification model, I started with convolutional neural networks, or CNNs. Here, filters are passed over the input image to extract low-level features such as edges. By building convolutional layers on top of convolutional layers, the model is able to detect higher-level features such as wound area from lower-level features such as wound edges. In fact, we found the best performance training 5 different CNN architectures and ensembling them by averaging predictions. I also augmented my training data by rotating and reflecting each training image. This means that our dataset training size was 6 times as big, and this significantly increased our performance. I held back 870 images from the training and validation procedures to evaluate our model. If we had 20 patients, 10 with infected wounds and 10 with uninfected wounds, we would expect our model to correctly predict 9 infected wounds and correctly predict 9 uninfected wounds. This corresponds to a true positive rate of 92% and a true negative rate of 93%. And this is particularly exciting as it outperforms some current benchmarks that we see within the literature. So I have to warn you now, on the next slide, there are 2 medical images. I've overlaid these with heat maps, but still, please do look away if you are squeamish. AI explainability is very important for medical imaging. Here, I've visualized where my model is looking using an explainability technique. We can see our model learns features which are consistent with what a medical professional may look for. For example, the model appears to learn that this bright red coloring is a sign of health, and that this mixed red and yellow coloring is a sign of infection. We've already begun implementing the model by running a live study in which Dr. José makes a clinical diagnosis. He then sends a swab to the lab for analysis. And finally, he sends the image to the model for an AI prediction. José and José are also now looking to raise funding to build an app. So if we have any potential investors in the audience, please get in touch. We're really excited about the impact this project will have, as it will help doctors and nurses to detect infection more quickly. It may also assist patients and caregivers to decide when to seek medical help. By treating infection earlier, we will reduce the healthcare costs of chronic wound management, currently at 6.5 billion in the UK. And most importantly, we can bring down the number of amputations and improve patients' quality of life. Thank you for listening.